Now, let's talk about the proximal. So, once you hear proximal, have you heard of the word the ornithological specimen of identical plumage invariably conglomerates to the nearest proximity? What is the meaning of that word? Bed of the same feather flaps together. So, proximal, nearer, less conglomerates to the nearest proximity, meaning let's move forward, let's come together to the nearest place or the nearest origin. So, example, the arm is more proximal than the forearm, nearer point of origin of attachment. So, proximal means when something is nearer to the origin or from where it is originated from, we said it is what? Proximal. Example, now, this is my arm and this is my forearm. Now, take a look at my arm and take a look at my forearm. We said our arm is more proximal than the forearm, meaning that it is more closer to the what? The origin. Now, if you observe the upper limbs, I hope you are not confused about the upper limbs. So the upper limbs is this region. Now, if you observe something about these the upper limbs originated from this region. So, due to this reason, the arm is said to be more nearer. The arm is more closer to the site of origin, to the point of origin. This reason we now say the arm is proximal, while the forearm is what? Distal, because there is something that is more closer than the arm. So, proximal means more nearer to the point of origin, while distal means far away to the point of origin. Now, this is my hand, and in this my hand, it is said to be what? Proximal, when it is said to be distal when compared to the forearm. Now, why is the hand now distal and the forearm is now proximal? Because the forearm is now more closer than the arm when compared, when you compare both of them. This is also applicable to the leg and the foot and the hip. Now, in this hip region, hip is more closer to the origin. So this is my hip region. So hip is more closer to the origin, while the leg is more distal. So due to this reason, when I say hip is proximal and leg is what? Distal, because it's more what? Far away. Now, distal means further from the point of origin or attachment. Now we have the hand, we have the dorsal surface. The Greek word is what? Dosom. And the palmar surface. The Greek word is what? Palm. The palmar surface. So the palmar, when you stand in anatomical position, as we have already discussed in this video, that region in which the arm, you can see the arm anteriorly, we said it is what? The palm. So this is the palm of the hand. So the frontal part of the body, which is the anterior surface of the body or the ventral surface of the body, that region is the palm, or in the supination of the arm or the upper limbs or the forearm, we said what we are seeing is the palm. While at the back, when you view the body from the back, from the posterior region, that region in the hand is now called the dorsal surface, while the palmar surface are that surface when you view anteriorly is called the palmar surface. Now we have the foot. The foot also have the dorsal, which is also known as the dorsum, and the palmar surface. So the palmar surface is on the ground, while the dorsal surface is the part of the foot in which we can see. Now, we have two main anatomical position, but let me introduce you before explaining. So we have intention. Just take a look at these diagrams. Now look at our flexion. Flexion means you are decreasing the angle, you are pulling it away, you are decreasing the angle, you are trying to make the angle towards decrease. While extension is any movement that leads to the increase of angle. So flexion, you are trying to decrease the angle. Extension, you are trying to increase the angle. Now look at the flexion, you are decreasing the angle. Extension is now at angle what? At angle 90 degrees. Now this is what? Extension, and this is what? Flexion. So if you measure the angle from here to here, you see it's more bigger than here. So in flexion we are decreasing the angle, in extension we are always increasing the angle.